Welcome back to Decode Healthcare with Harshal. Let's jump right into part 87 of our Explainer series, where we are totally cracking the code on Chapter 20 of the CMS official guidelines. We're talking external causes of morbidity. Today's mission, conquering the incredibly strict rules for coding the cause of an injury, the intent behind it, the place it happened, and exactly what the patient was doing at the time.
So, have you ever thought about how we code the actual story of an injury? Because in the real world, a trauma is never just a fractured bone or a burn. It's a whole narrative, right? It's a patient falling off a rickety ladder while painting their house, or maybe a driver getting into a massive collision on the interstate. Translating that real-world drama into a sequence of flawless CMS-compliant codes is exactly what Chapter 20 is designed to do. It literally captures the who, what, when, where, and how of the entire incident.
Here is our quick roadmap for this explainer. We're covering the absolute boundaries with the never principle rule, building out the precise for-code stack, looking at how the dimension of time alters your coding, and setting up the strict guardrails for intent and character matching.
Okay, let's kick things off with Section 1, the never principle rule, which sets the absolute boundary for this entire chapter.
Rule number 1 is what we call the never principle law. External cause codes, everything from V00 to Y99, are strictly secondary. Let me repeat that because it's absolutely crucial. They can never, under any circumstances, be reported as your first listed or principal diagnosis. They exist purely to provide supplemental data.
Section IC 20.6a of the CMS guidelines leaves literally zero room for interpretation here. Your primary diagnosis must always be the injury itself. You know, the quote from Chapter 19 that describes the physical trauma. The external cause, it's just the supporting cast.
Think of your claim in two distinct parts. First, you have your primary injury code, telling us what the trauma is, like a fractured tibia. Then, your external cause codes step in to tell us how and where it happened. You've got to lead with the what before you can ever attach the how.
So let's move into Section 2 and look at the core mechanics of actually building out this perfect claim sequence. This is where a lot of coders can get tripped up.
When you're building your claim right after that primary injury diagnosis, you have to follow a strict for-code external stack priority. Always lead with the cause and intent. Follow that up with the place of occurrence, then the activity code, and you finally cap the whole thing off with the patient's external cause status.
Let's break down Step 1. You must capture the primary mechanism of the injury. This is the anchor for the rest of your external stack. We're talking about figuring out if it was a transport accident from the V category, a fall from the W category, or maybe an assault from the X or Y categories. This code explains the direct physical event that actually caused the trauma. Then, for Step 2, we bring in Category Y92, the place of occurrence. This locks in exactly where the patient was standing, driving, or working when the event happened. Were they at a single-family home, a local baseball field, or out on a public highway? You assign this immediately following your cause code to give real spatial context to the injury. Moving right along to Step 3, the Y93 activity code tells the payer exactly what the patient was doing. Were they doing yard work, playing a sport, cooking dinner? This isn't just busy work. It provides vital data for national injury prevention research and helps insurance companies truly understand the exact circumstances of the claim. And finally, we cap off the stack with Step 4, Category Y99. This answers the status of the patient at the exact time of the event. So, was the patient a civilian just doing a leisure activity? Were they active military personnel, or were they on the clock working? That last one is a massive trigger for workers' compensation, by the way. And there you have it, your perfect for-code stack. All right, let's jump into Section 3, where we introduce the dimension of time. The rules here completely flip depending on whether we are looking at a brand new injury or a follow-up recovery visit. Listen closely to the initial visit rule because it's a big one. Place of occurrence and activity codes are essentially a one-time assignment. You apply them when the patient is receiving active treatment on that very first initial encounter, which gets the 7th character A. But on a subsequent encounter, character D, when the patient is just in the healing phase, those Y92 and Y93 codes drop off the claim entirely. You strike them right out. And this exact same limitation applies to a sequela, meaning a late effect or residual condition, which gets the 7th character S. Just like with subsequent care, we completely drop the place and activity codes here. Why? Because we are no longer at the original scene of the accident. You only use the main external cause code with the S extension to show the historical link to that past injury. Let's move into our fourth and final section, defaults and character matching. These are your absolute guardrails for clean claims.
So let's talk about intent. When a patient comes in, the exact intent isn't always perfectly spelled out by the provider. If the medical record is silent on whether an injury was an accident or an assault, CMS demands that you strictly default to accidental intent. Plus, all transport accidents automatically assume accidental intent right out of the gate.
This rule is a massive compliance firewall. It explicitly prevents us coders from just assuming criminal intent, abuse, or self-harm without concrete medical documentation to back it up. Never, ever assume. If it's not explicitly documented as intentional by the provider, it is an accident, period.
Now, here is our seventh character extension matching law. This is so important. The seventh character on your external cause code must perfectly mirror the seventh character on your primary injury code. If your fracture code gets an A for an initial encounter, your external cause must also end in A. If the fracture is a D for subsequent, your cause must be a D. They have to match perfectly.
Because if they don't, a mismatched claim is an automatic red X at the clearinghouse. If you submit a claim with an A for the primary injury, but carelessly leave a D on the external cause code, the system will kick it back immediately. Think about it. It's a logical impossibility to have an initial encounter for an injury, but a subsequent encounter for the cause of that exact same injury, right?
So, just to summarize the whole shebang, this is what a fully compliant initial visit claim looks like. You have an unbreakable never-principal boundary where the main injury leads the charge. You have a perfectly sequenced four-code external stack, starting with cause, then place, activity, and status. And you have beautifully matching seventh character extensions across the board.
I really hope this explainer helps you master Chapter 20 and keeps those claims super clean. But it kind of leaves you wondering, how do we tackle situations where the patient isn't injured at all, but rather just seeking screening services, or maybe they're impacted by social determinants of health? Well, that takes us straight into Chapter 21 and the fascinating world of Z-codes, which we are going to uncover in our next explainer. Thanks for decoding healthcare with me today, and I'll see you in Part 88.